The COVID-19 pandemic has changed a lot about how we do things. The changes have affected the political, economic, and social spheres. As limitations on human interactions become a reality, certain groups in society are feeling the effects, among them the elderly. Citizen TV's Martin Munene engaged this important group of people in Nyeri County and tells the story of a group that has been having a hard time since the presence of COVID-19 was confirmed in the country.
The COVID-19 pandemic has changed the way we live. Ordinarily, most of those working in cities and towns away from home visit their loved ones in rural Kenya often when they are not at work, and others bring their aging relatives to live with them in their homes in the city. That has changed considerably. In Moiga village, Nyeri County, 82-year-old Emily Werimo and 70-year-old Michael Nderito are among a group of the elderly who live a stone's throw away from each other. They are engaged in a chat. They say they do not know much about the coronavirus, but it has changed the way they have lived and interacted for decades.
Hata ukamata chakula la viga au na kuchukua kitu oga mkono.
Maisha yangu inabadilisha sana, maana siwezi kukusalimia na mkono. Siwezi kukukaribia wewe. Mimi nikae kado na wewe ukae kado, tuwe tunaongea tukiwa mtu kado yake.
They say they do not see their loved ones who live away as often as they did before, but they understand that these are not normal times.
Hata sisi tunaogopa hawa wasije wakaja hapa tupate hiyo ugonjwa.
Anaambia mimi mami sisi hatukuji baba ndiye anapungwa shauri ya corona ya nini ya ugonjwa ile.
For the past 3 months, Eutychus Mushiri has not seen his parents who live in Othaya, only 25 kilometers from Nyeri town where he works and lives. The reason? The fear that he and his siblings could put their 72-year-old mother at risk of contracting COVID-19, seeing that the bulk of those with the virus show no symptoms.
I had that fear that maybe I could be one of those who are suffering from this disease, but I didn't show any symptoms. Maybe I didn't show any symptom like many others, people of our age and younger than myself. So that's why I decided to keep away from home.
And Mushiri is not the only one. He says that as siblings, they agreed to be calling home as often as they can to check on their parents and send whatever help is needed. They use mobile money transfer or courier services.
Or use courier services like the matatus, the 2NK, such, or maybe use bodas to send any assistance to her home, but to avoid going there. Yeah, that's the only way that we can keep her safe from contracting this disease.
Joyce Cairo runs Purity Care Foundation, an organization that works with the elderly. She says that a lot of them are lonely due to the health restrictions set up to protect them.
They become lonely, they become depressed because they're not able to see their lovely ones or their loved ones. They become lonely because they're not even able to socialize and to interact amongst themselves.
But the effect of the COVID-19 pandemic on the elderly is not only the risk it poses to their health or the social aspect of it. It has a big negative financial implication as well, especially for those in rural Kenya who depend on help from their loved ones working away from home due to massive job losses and a declining economy in the country.
Many kitchens in rural Kenya do not have food, as the elderly here depend on the young ones in cities for assistance, and most of them have lost jobs or have been affected by the COVID-19 pandemic. Martin Munene, Citizen TV, Nyeri County.